On behalf of the College of Southern Idaho and the City Club of the Magic Valley, I want to thank you for attending tonight's event and welcome you to the College of Southern Idaho. We're always honored to host these City Club events and excited about the opportunity to talk about Magic Valley safety this evening. I want to first recognize a couple of folks that are in the audience and want to be with one of our trustees, one of our CSI trustees, who actually he's sort of here filling double roles, I suppose, and that is Dr. Josh Burke from St. Louis. Thanks for coming. We've got a lot of other dignitaries in the audience, several of whom I would like to recognize everyone, but I will no doubt forget someone. So I'm going to just jump to the top and I'm going to recognize Mike Pinello from St. Louis and thank him also for coming tonight. So we'll go ahead and get started. My name is Chris Bragg. I'm the Dean of Institutional Effectiveness and Communication here at CSI. I also am a member of the Center for Community Health Advisory Board. I'm going to be your moderator for tonight's event. The City Club of Southern Idaho is an independent, nonpartisan organization that provides a forum to bring people together to explore issues of interest through civic discussion and in the pursuit of promoting community through civil dialogue. We appreciate that you join us tonight to explore this important topic. In the late 1990s, journalist Barbara Wright decided to investigate the challenges that are faced by low-income workers in America by attempting to live on the wages that are paid to unskilled workers in our society. Following her months-long experiment, she published a book titled Nickel and Dime on Not Getting By in America. Many of you may recall that book. And in it, she describes her experience. In the book, she notes the following. She states that there are no secret economies that nourish the poor. On the contrary, there are a host of special costs. If you can't put 2 months' rent together to secure an apartment, you end up paying through the nose for a room by the week. If you have only a room with a hot plate at best, you can't save by cooking up huge lentil stews that can be frozen for the week ahead. Instead, you eat fast food or the hot dogs and the styrofoam cups of soup that can be microwaved in a convenience store. If you have no money for health insurance, you go without routine care or prescription drugs, and you end up paying the price. She goes on to say it is common among the non-poor to think of poverty as a sustainable condition. What is harder for the non-poor to see, according to Wright, is that poverty is acute distress. The lunch that consists of Doritos or hot dog rolls leads to faintness before the end of the shift. The home that is also a car or a van. The illness or injury that must be worked through with gritted teeth because there is no sick pay, there is no health insurance, and the loss of just 1 day's pay means no food for the next. Wright concludes that these experiences are not part of a sustainable lifestyle, even a lifestyle of chronic deprivation and relentless low-level punishment. They are, by almost any standard of subsistence, emergency situations. And this is how we should see the poverty of many millions of low-wage Americans, as a state of emergency. Although Wright conducted her research in Florida, Maine, and Minnesota 25 years ago, the issues and challenges that she found were the same issues that we are here to discuss tonight. We're so fortunate to have two wonderful panelists with us this evening who are going to help us understand both the challenges that we face as a community and to help us learn more about a new resource that is poised to help address those challenges. I'm going to introduce them in a moment, and following their presentation, we're going to have some time for questions. When you walked in tonight, you were handed an index card, and please feel free, if you have a question as we're going along, jot those down. When our presenters are finished tonight, I'm going to come back up and I'm going to pepper them with all sorts of fantastic questions that have come from you. So I look forward to seeing what you come up with. And I would ask that you write legibly so that I actually ask what you intended that I ask. All right, without further ado, I want to introduce our two wonderful panelists tonight. I'm going to start to my immediate left with Kylie Goff. Kylie is the Community Health Manager for St. Luke's Magic Valley and Jerome. She is a registered dietitian nutritionist and a licensed dietitian. Kylie has worked for St. Luke's for more than a decade. Her various roles at St. Luke's have included working in clinical dietetics, employer wellness, and community health. Kylie has been instrumental in convening, and I would say, dare I say, wrangling the people involved with putting together the Center for Community Health. It certainly would not exist without all the work that Kylie has done to get us here today. She has a bachelor's degree in kinesiology and exercise science from Lewis Clark State College and a bachelor's degree in dietetics from Idaho State University. She also serves on the Twin Falls Area Chamber of Commerce Board and the board of the Idaho Academy for Nutrition and Dietetics. Kylie was born and raised in the Magic Valley and is passionate about giving back to her community and creating environments that allow people to thrive. And on my far left, Maria Contreras. Maria is the newly hired director of the Center for Community Health, which you'll be hearing more about tonight. And she is a licensed master social worker. As a social worker, Maria has more than 7 years of experience in providing support and assistance to individuals and families in need. Her passion for and commitment to making a positive impact on the lives of our most vulnerable populations is what led her to pursue her degree in social work. Maria has worked for Family Health Services for 14 years in a variety of positions, including as a medical assistant, in chronic care management, and in care management coordination. Maria has also worked in case management and in counseling. Throughout her career, Maria has worked with diverse communities to address issues such as homelessness, domestic violence, substance abuse, disease management, and child welfare, just to name a few. Maria earned her medical assistant technical certificate. Where did you get that again, Maria? Right here at CSI. Thank you very much. My boss is in the room. I wanted to make sure that we got that in. She's also gone on to receive a bachelor's and a master's in social work from Boise State University. Maria is a longtime resident of Twin Falls, where she resides with her husband and their dog. Maria is committed to advocating for the well-being of those she serves and to implementing effective interventions to promote self-sufficiency and empowerment. With that, I will introduce Kylie and Maria.
Donna, can you guys hear me okay? Okay. Okay, I'll speak up a little bit louder. I tend to be on the fainter side. So thank you for that great introduction, and thank you all for having us tonight. I'm very excited to be here at this momentous time to get to share about the Center for Community Health, how we got here, and that we're here today and we have Maria hired to do this great work. So Chris gave us a great introduction, and I also echo his thanks to so many people in this room. I see Mike, Chris, Dr. Fisher, so many that are a part of our consortium that really have helped us to get to this place. Jody, I'm sure others. So thank you to all of them for their support in advocating and seeing their vision and helping us get to this point. So like Chris said, I am local to this area, born and raised. His story from the book, I've actually read that book. And interesting, as I heard him talking about me, I was a lot about food and nutrition and dietetics, but you don't see a lot of dietitians get to work in the community health space as often. But I feel so fortunate to do that because there's so many of those factors that really impact the choices that people are making and the impacts it has on their health. So grateful to be here and share a little bit more with you. So we'll get started. Bree, do you want to come up too?
Yeah. Can you hear me? I'm on this side. Okay. Well, hello, everybody. As mentioned, my name is Maria Contreras. I want to thank everybody for having us tonight and allowing us to share our project for our community. A couple of fun facts that were not mentioned during my bio is that I'm originally from El Salvador, a small little country in Central America. English is my second language, if you can't tell. And I had the privilege to have been able to move to Twin Falls, Idaho in 1998, along with my family. Most of my childhood and all of my adult life has been in the Twin Falls, Idaho. I consider Twin Falls my home, and I wish nothing but the best for our community. And with that insight about me, I would like to jump to our presentation. Down. Maybe. So I'll get started as they navigate that. I want to start with a small survey with you all. There's no need to raise your hand. There's no need to any participation or anything like that. But I want you to reflect on the time where, if it applies to you, how these questions might have affected you in your health and your well-being and so forth. First question. Have you ever been in a situation where you were so stressed because you couldn't pay for your rent, your mortgage, you couldn't pay for your essential household items, and you had to choose between paying all your bills, your utility bills, versus repairing your car to get to work? Have you or a family member ever suffered from any opioid abuse, mental health issues? Have you ever felt unsafe by your partner, a family member, or unsafe in your neighborhood? You may be asking yourself how these questions are relevant today.
So these questions that Maria has posed and many others are really the indicators we look at, which are those things that are the social determinants to our health. Our health is impacted by so much more than the general things that we think about, but things like our ability to pay for our food, our ability to access those things, ability to have transportation to where we need to go, to see medical appointments, to have insurance, to get the medical care that we need. And so many others are what we're really going to be at the root of our conversation today. And so we just wanted to call your attention to this slide that shows sort of what those factors are.
Like Dalai Lama said it best, whether one is rich or poor, educated or illiterate, religious or non-believing, man or woman, black, white, or brown, we are all the same. Physically, emotionally, mentally, we are all equal. We all share basic needs for food, shelter, safety, and love. We all aspire happiness, and we all shun suffering. Each of us has hopes, worries, fears, and dreams. Each of us wants the best for our family and loved ones. We all experience pain when we suffer loss, joy when we achieve what we seek. And this fundamental level, religion, ethnicity, culture, and language make no difference.
Thank you, Maria. And we hope that that can give you a picture of the conversation we hope to bring forward to all of you today. I want to give a little bit of a picture of what we're going to walk you through. So you'll first hear from me. We want to give some data and findings from an assessment that St. Luke's had funded called a Healthy Conditions Assessment, with this work beginning in 2018 and 19. Then fast forward a little bit to give you a picture of what we're seeing in 2023 from our Community Health Needs Assessment, how those things connect and how they have really led to the formation for the Center for Community Health. What that is, the partnerships, the commitments towards that, and really defining what is the center and what will it provide to Twin Falls. So I will kickstart us for the presentation today and kind of walk us through some data and history of the center. So this slide is to give you a little picture of the timeline because it is sort of a long one. If you can see, we started our assessment in 2018. That was our kickoff to that work. And we're here today in September 2023. And so it has a long timeline. And so I want to just give you a little context to that. But I started my role in 2017 as our community health manager in Magic Valley. And in that time was hitting the ground running, trying to understand what are the needs of the community and how can I better understand those to make implementation strategies and work with partners to address those needs. And I was fortunate at the time to be aware of an assessment that was done in Nampa, and it was called a Healthy Conditions Assessment. That led to some really informative data and also some great partnerships and initiatives to support that community. And so I was able to advocate for that assessment, and St. Luke's leadership supported me and was able to provide funding to do that. And so in 2018 was our sort of start of the story, and I'm going to walk us through a little bit about that assessment. So what is a healthy conditions assessment, you might ask? So these two things here really help describe that. So the little webbing here is really a description of what is it doing. And a healthy conditions assessment is looking at our dimensions of health and wellness and crossing them over to look at the elements of a comprehensive plan within a city and how those two things can impact our overall health and ability to have positive quality of life. And so those social determinants of health that I was talking about are a big factor in that. And so we've been very fortunate. The city of Twin Falls has always been a great partner and willing to look at those things and take a, look in the mirror to say, how do those things impact our health, as well as the many other partners, including St. Luke's, to do the same thing. What's really empowering and helpful about the Healthy Conditions Assessment is that it looks not just at a county or city level, it really dives in deeper to get a picture of what's happening in census tracts. And so this image is a picture of Twin Falls and the various census tracts that exist within that. So it really essentially is telling us where are the hot spots within a community that might be more in need or have further inequities to achieving their overall health. So just to walk you through a little bit there, I want to share some of the findings that came out of that. And so there's a variety of factors that were assessed, very, very many data points, but these are just a few. And I want to call attention because what you'll see is a theme. And so in each of these columns, the column on the one side is the tracts, and then you're looking at the indicators. So we're looking at percentage of those who have health insurance, percentage of those in the household that are receiving SNAP benefits, those that do not have a vehicle in a household, and poverty status. And as you look across all of these findings, you will notice that Census Tract 11 tends to be of much higher need. So for example, in the health insurance finding there, about half of the people in that census tract did not have health insurance at this time. About 28% of them, over a quarter of them, were receiving SNAP benefits, which is to receive that as 130% of the poverty guideline. 13% did not have a vehicle. All of these factors are those things that influence our ability to achieve our optimal health. And then looking at one further is just looking at education. So those achieving high school graduation and beyond. And this is really important. One astounding fact that I learned is that we look at reading levels in third grade to help us determine the amount of jail cells we need, which is just scary to think about. And so our education status of our community is a huge indicator of our community's health and their ability to achieve that for themselves, their families, and for the community as a whole. So again, Census Tract 11 sort of rises to the top in this community in this finding as well. And then this is just to give you a bigger picture. So kind of taking this all together, these are the various data points that we saw. So they looked at more than I just shared with you, but a variety of those, and then sort of ranked them, right? As we look at all these census tracts, what's flagging, who's flagging, and what is it telling us? And so Census Tract 11, or the downtown corridor of Twin Falls, followed by sort of the southern region of Twin Falls, and Census Tract 8 were the sort of top four, but really the downtown and southern of most need. The next layer of this data was looking at, okay, we know from data sets, objective pieces that are out there, these are some in-need folks, but what are they really facing? What's their story? What would they say? What would the organizations and partners that are supporting them tell us? And so that was the second piece of this assessment, was really diving in to go have conversations with the organizations, the people that live there, et cetera, to say, tell us about what you're seeing. And really this idea of our North versus the South, or the have versus the have-nots, have emerged. And these four themes rose to the top. So trauma and crisis, transportation, housing, and deteriorating families. I'm happy to say in the transportation realm, really excited to see that Twin Falls has brought Ride TFT, which I think already is a huge asset and has been used tremendously to support the transportation needs of our community. And I imagine that will continue to increase usage over time and be a huge benefit from that lens. So there are things that have happened since this time that are good. And you can kind of just read through this and see some of the themes that are underneath those, like what were they saying, right? A constant feeling of fight or flight, stress within families. That leads to so much anxiety and inability to make decisions or think forward long-term about impacts of the choices they're making day to day. Housing market pressures were high. That was in 2018. So that's even increased today, right? So all these things were the themes we saw then, and huge factors to what was impacting our community. So we found all that data. We recognized there was some significant needs rising to the top of certain populations within our community. And what we said was, we don't want this to just be an assessment that sits on the shelf. We really need to do something about this. How can we come together with partners to do that? And so we were able to share the findings in November of that year, and then bring partners together in May 2019 to say, how can we strategize? And we were so fortunate and grateful that over 70 partners in our community came together to say, let's do something, and sort of worked collaboratively, did some strategic planning ideas and those things, and landed on this idea for a Center for Community Health, a hub and spoke model to help resource and navigate folks to needed services within the community. As you can see, we formed our stakeholder group in February 2020. So there was that. Let's turn the page on that. So we were delayed, right? Here we are, 2023. But I'm so grateful that the partners came back together following that and said, we are not going to let this go. This is still important, and we will continue forward with that work. And ultimately, we had some good conversations at the time to say, do we need to do another assessment like that? You know, have things changed? And ultimately, we said, yes, things may have changed. They have worsened, right? We're on the right track. This path that we're moving forward on still is the right thing to do. And we don't want to derail or delay it by stopping to do another assessment. We want to continue forward on this path. And fortunately for our group, St. Luke's already has a requirement to do some form of an assessment as well on a 3-year cadence. And so we knew that was coming and could kind of help reiterate things that are happening and give us a look at that picture, but keep us on the track forward. And so that's what we did. And I just want to give you a snapshot from our what we call Community Health Needs Assessment, CHNA, that St. Luke's does every 3 years. So the CHNA is a requirement by the IRS for St. Luke's. It is a representation of who makes up 70% of your inpatient hospitalizations. And so for us, that is Twin Falls and Jerome County residents. So a bit bigger picture, but helps to reinforce what are we seeing and what's the issues within our geography, recognizing the Magic Valley, and Twin Falls is likely a hub for many people across the Magic Valley going to seek services. So that process, while slightly different and not at the census tract level per se, still has a thorough process of which we collect surveys, we do focus groups, we have key informant interviews, we take those things as well as the objective data that's been, more recent years forward at this point to look at those two things collectively to say, okay, what is that telling us? What issues are rising to the top? And through that, we just completed our 2023 CHNA in June, and the 3 priority areas that emerged were access to health-related services, including language and cultural barriers, mental well-being, including suicide, and cost of living, including housing, childcare, and education. And as you read those and hear those, I'm sure you can hear sort of themes from what we were seeing in the other assessment as well. So I'm just going to walk you through a little bit of that information to give you a picture of what does that mean? What are the real issues underneath those things? And what are we seeing in our community? In the access to health-related services bucket, our respondents really reported difficulty accessing healthcare and health-related care. So the cost was a factor. Insurance problems, lack of coverage or not enough coverage were problematic. Language and cultural differences and long waits to get appointments. When it comes to the types of services too, I got ahead of myself. I'll come back to that. My apologies. So, and also when it comes to access, we also have a really low primary care physician ratio compared to the national average. So if you look at our national average, it's 89 providers per 100,000 residents. And in Twin Falls County, we're looking about 70, and in Jerome County, about 40. So those wait times, those things, those are true barriers, right? We don't have enough providers to likely meet the need. And so other solutions or alternatives are something that needs to be looked at. And then when it comes to the access types of issues, what rose to the top? Mental health care services were on the top of that. Substance use disorder, exercise, physical activity, healthcare services, and family planning and oral care. So I think it's a sort of resounding mental health services at the tip top of that list. When it comes to mental well-being, what is the data kind of behind that in terms of rising to the top? And I think this is one of those really catchy stats here. So Idaho is considered a mental health shortage area. And as we look at Idaho as a whole, it's 308 to 100,000. So providers per residence is the what Idaho's looking like. And Idaho, again, is a shortage area. Then you look at Twin Falls County, a bit higher, but Jerome is incredibly low. And we know that likely so much of who is in Twin Falls providing that care is supporting the larger geography. And then Idaho consistently ranks among the highest in all of our states for suicide rates. So I'm sure you have probably heard of this or seen this in the news at one time. In our most recent data, these are sort of the rates. So Idaho, again, top 10 at any given time. And Twin Falls County is higher than Idaho. And then as we look at our young adult rates, it is astounding. 49 per 100,000 deaths by suicide in our young adults, which is incredibly high. So very sobering statistics. Lastly, we come to cost of living. And this data is actually taken from Idaho's ALICE report, which is done by our United Way. And the ALICE report looks at, ALICE stands for Asset Limited, Income Constrained, Employed. So those who are working to try to make a living but aren't making enough to do so. And so this graph, which is sort of hard to see, the dark blue shows those living in poverty, and the light blue is those in ALICE. So slightly above that, but still not enough for a living wage. And as we look at Jerome and Twin Falls County, I think this one just stands out to me so much that almost half of our residents here cannot make ends meet. That's what it tells us. And so they are making those choices that Chris alluded to in that book to say, is it food this month? Is it medication? Right? They're going to have to make those really tough decisions. And so I think this really is at a root of what the center can address and support. And just looking at that data really calls out housing, again, rises to the top in there in terms of what are those cost of living issues, low wages, prescription drug costs, those and a few more on the top there. So just want to call attention to that. So that can be a little bit of a downer, but I want to lift us back up because Maria's here to talk about the good stuff, which is the center and the idea that we recognize this data is true. It is before us, but how do we do something about it? How do we come together and support our community? And so Maria's going to talk about that, the development of the center. And I will just say, from St. Luke's perspective, we are very fortunate that we have a Center for Community Health in Wood River, and they are a tremendous asset and resource to the residents that live in the valley up there. And so we were able to look at that model and sort of take the good parts that work for the Magic Valley, understand the nuances of our community, and develop what makes sense for us. So I'm going to turn it over to Maria to talk about that.
Thank you, Kylie. Thank you, Kylie. Okay. So how are we going to make this possible? Can you hear me? Okay. I'm pretty loud, so I don't even need a mic sometimes. So I want you to meet our consortium members. Okay. A group from multiple different organizations who came together to achieve a common goal and have pooled all their resources to start Center for Community Health. We have 8 organizations committing their time and resources, and a consortium agreement was signed on March 2023. As you can see, that's a photo from that day that they signed. I think we're missing some in there, but most of them were there. So, sorry guys. So here's our partners. They're committing a lot of resources to us. We have Family Health Services, who's providing the staff, such as myself, benefits and marketing and operational expenses associated with the vehicle and IT support. We have the Twin Falls School District, who's going to provide free lease and office space of up to 4 community health workers staff, as well as IT support. We have the Twin Falls County, who's been able to provide us some funding for a vehicle as well. And we have St. Luke's as well, who's providing salary for staffing, community partners and around strategy, ongoing training and support. They also provided a facilitator, correct me if I'm wrong. City of Twin Falls provided us a facilitator back in 2021 to 2022 to develop the Center for Community Health. We have public health, as well as strategic financial group, who's providing in-kind services. The College of Southern Idaho, who's providing grant assistance, as well as the City of Twin Falls. I do want to say that the City of Twin Falls is actually considering future funds from their community development grants in 2024. And with that, and thanks to the consortium and all their resources they brought together, I was hired in July of 2023. So what is the purpose of the Community Center for Community Health? Still having a hard time saying that. Our purpose is to provide non-clinical care navigation services to the community to access needed services, such as services, somebody who's walking in who needs services about alcohol and substance abuse. The center will be able to provide navigation services to be able to get them to the appropriate needs or treatment, as well as domestic violence assistance, providing them and advocating for them to be able to connect them to our resources such as Voices Against Violence. We're going to assist with dental, visual, and medical care as well to help them navigate the whole dental, visual, and medical care, as well as housing, and utilities, food, and one of the biggest one, insurance, to be able to help our community and help them, assist them in getting insurance, such as through the Affordable Care Act, Medicaid, Medicare, depending on their eligibility. Our intent as a center is to be an advocate and a liaison to our clients. We understand these services are not new. And keep in mind the needs, we kept in mind the needs of our Twin Falls and the Magic Valley. So we model after, like Kylie mentioned, River Center in Haley, as well as Family Health Services Outreach and Enrollment Team, who work on these type of navigation services within their patients and the navigation services through the Department of Health and Welfare. I know these services are very important and can be impactful to somebody who's trying to navigate all their issues. They're trying to navigate, certain things that come up in life. In my previous role, I was fortunate enough to have a group, a team, who encounter multiple individuals who came through our doors and indicated they needed assistance. Sometimes it's just they needed that emotional support or us connecting them to those services. Other times they were more serious. I would like to share with you a couple of cases just for you guys to have an insight of what we could be doing for this in the center. Case number 1, we have a young girl who was trafficked into the States and was put through domestic violence by her partner. He left her physically and emotionally damaged. After the girl had the courage to call the police on the abuser, the client found out she was 3 months pregnant Once the client confided to the community health worker, she was able to find access to secure shelter and other community resources to help her start over again. The community health worker also advocated for family health services to waive the clinic fees for her to have OB care and ensure that she had a healthy pregnancy and delivery. In this scenario, the community health worker served as a liaison between resources and an entry point for the client to get away from her abuser. A household of 5 with children, 2 children having special needs. The dad lost his job as the mom was admitted to the ICU for medical complications. The family found themselves homeless and not knowing what to do. Through a social determinants of health screening, the community health worker heard about it and was able to follow up with the patient and assist the patient to get a motel assistance through other community organizations. The community health worker was able to provide community resources such as DI vouchers, food and gas assistance, to name a few. She served as a liaison between the community resources to assist the family to some rough patch. And then we have another case, a recently divorced mother of 4, 1 child with Down syndrome, a very low-income household, found herself and her children living in a trailer home that needed significant improvements to be livable. Mother worked full-time and received no assistance from an ex-spouse, had to choose between buying essential household items for her new home or repairing the trailer for the winter. Community health worker was able to provide assistance by providing her DI vouchers, advocated for the community for essential items such as bedding, furniture, food, clothing, and other essential items for the family. Upon the follow-up with the family, the mother reported the oldest, who was suffering from depression and anxiety after the separation of her parents, was doing much better emotionally upon receiving the assistance. Mother was able to save enough to repair for her home for the winter. The family was able to restore their dignity and confidence, and they were very thankful and relieved they received the assistance from the community to be able to have a safe and stable home. With those stories in mind, what are our goals? The Center for Community Health goals is to improve the community members to have access to essential services providing efficient navigation assistance. We also intend to help decrease the health disparities among underserved population by ensuring they can access appropriate health care and support services. We want to empower individuals and families to make informed decisions about their health care, social, and support needs. We want to increase the utilization available from our community resources by guiding individuals to resources to their specific needs. And lastly, and most importantly, we want to enhance the overall quality of life for the community members by connecting them, like mentioned, with resources that address their social determinants of health. Our approach. We intend to be trauma-informed, resilient-informed, client-centered. Want to be able to have very great skills in motivational interviewing and intensive listening. We're going to be trained as community health worker and be certified. We want to be certified as Your Health Idaho connectors to be able to help our community apply for insurance through the marketplace, as well as the Sheba counselor advisor to help our elder population receive the assistance that they need through the Medicare, as well as being able to help our clients with Medicaid and Social Security processes. There's a lot of training. So where are we? Like I mentioned, I was hired back in July. The last couple of months, I've been working on these trainings, as well as setting up policies and procedures. In the next 6 to 12 months, we hope to bring on at least 1 to 3 outreach staff workers, or I want to call them community health workers. And we're focusing on seeking grants and other fundings as well. Taking into consideration what Kylie was talking about, our healthy conditions assessments and its results, the consortium came together. As they came together, they decided to the best location for the center, and with the Twin Falls School District being a member of our consortium, decided the center to be downtown. Okay. We're going to be sharing offices with the school support services as well. So we're going to have great connections there as well for our families and kids in school. The building is currently being remodeled, and it should be done by the end of the year. If anybody's doing construction right now, I don't know if that's going to happen. We're hoping to be operational as soon as we can, and we have supporting staff. We want to be open Monday through Friday, 8 to 5. That might change as the need grows. We are going to accept walk-ins, referrals. Our services will be in person, as well as either over the phone or virtual, as well by outreach. So as you know, now you know, I hope we've done a good job on that. The purpose of the center and our services and how we're going to approach it. And you might be asking yourself, and I hope you're asking yourself, how can you help? Well, I'm taking any type of resources or connections to help me for the center, as well as any funding and donations to be able to bring on supporting staff. Thanks to our consortium, we're halfway there to our campaign plan. So we're hopeful that maybe once we're able to get some grants and more funding, we're able to bring in more supporting staff. And also looking for volunteers, somebody who's wanting to provide these type of services to our community, somebody who wants to learn a new skill set and wants to widen their services to our community. Our intention is to help on those that we can and anyone that we can. Mother Teresa said it best: never worry about the numbers, help one person at a time, and always start with the person nearest you. I want to thank you again for allowing us to be here. Here's our contact information for Kylie and I. And I think we're going to take some questions.
All right. Thank you both very much for that overview to help us understand a little bit better about what the Center for Community Health is and what we plan to do. We're going to leave your contact information. No, we're not. Never mind. We're going to put it back up there later, though, so that you can, in fact, get a hold of these two if you've got any sort of benefits that you can provide in terms of assistance along the way. We did hand you some cards as you walked in, and if you've got those filled out, I'm going to ask you to pass them to the outsides. We've got people on both ends to collect those. But while those are getting collected, I'm going to ask a couple of hard questions as we get started here. I'm going to start with Maria and ask a question of you. You mentioned navigation several times when you were talking. Can you help the audience understand a little bit better the distinction between offering clinical services in an environment versus offering navigational services? In other words, if someone is to walk in, what can they expect to get? Are they expecting to get treatment from the Center for Community Health, or what does navigation really mean?
So no treatment. We're going to be a non-clinical service, so meaning any type of service that we can provide that doesn't require any clinical need. If it's somebody who's like walking in or needing assistance, medical treatment, obviously at that point we have to assess them and send them over to the medical, not necessarily the medical side because we're not gonna have a medical clinic there, but near, somewhere that they can get that treatment needed. But the service is intended to provide assistance to those that need help with navigating any type of other social services needs. So nothing that is medical per se. We can example, somebody who walks in who needs assistance with insurance. Normally, you cannot get assistance insurance in the clinic besides maybe telling you if you have coverage or not. So somebody who needs help navigating that, how to, assessing their need at the moment they're walking in, helping them walk through either through the Department of Health and Welfare, getting them Medicaid or the Affordable Care Act, or if it's Medicare, getting them assistance through the Medicare pathway. Other services such as housing, utilities, car repairments, assistance in education, employment. Somebody who's looking at, either wanting to learn new skills or wanting help finding an employment, maybe doesn't know how to do online resume or doesn't know how to apply online because they don't know how to use a computer. Being able to be a center that maybe we can walk them through and submit that application for them, helping them find resources is going to help their well-being and, somebody to become functional and be able to assist themselves in the long run. I hope that answered your question.
I think it does.
Okay.
Thank you. Thank you very much. Their cards are flying in up here. I'm gonna ask Kylie a question, and then we'll get into your questions. Kylie, you've been on this project since its inception, and what excites you the most about where we are today in the journey that we've seen with the Center for Community Health?
That it's real. It feels real at this moment. It feels tangible. We have a director who is highly skilled and trained and has done this work. And so I have full confidence that she knows how to lead a team to help support our broader community and to be able to be before all of you at this stage, lets us know that it's going to happen. This will occur. And I finally feel like I'm at that moment in time. And, I've just been in my role for these 6 years, as I mentioned, and over have had outreach sort of asking for this type of help and have not been able to really help connect them or meet them to the right center to do this. And so I'm so grateful that we'll have this in place to now turn folks over to that can be able to really walk them through these challenges that they're facing.
Okay, thank you. So as I'm going through the questions here, I'm seeing a pattern, and the pattern that I'm seeing on a number of the questions is asking about, I guess, essentially what the Center for Community Health is going to do in relation to the root cause of the problem. So a lot of questions in here about, why are wages so low? Why, I know you both have the answer to that, so I'll let you explain that here momentarily. Why is there such a lack of providers in the area? Why there is such a shortage of physicians in the area? Why there's such a shortage of mental health workers in the area? And just questions about how you both perceive this working in terms of, is the intent here to try to address the root problems, which are things like poverty, which are things like a lack of services, or is it something different? What do you envision as success for the Center for Community Health? And I'll let either one of you take that.
Okay, I'll start because I think it's a really great question and a really hard question. And I think it's, yes and. So I think that initially it is essentially in some ways sort of a Band-Aid or a bridge to the next thing. It's recognizing the need of that crisis that person's in that moment and helping them get there. It is a little bit of hand-holding to help make that happen because we do have a lot of barriers for people in accessing services, and that's so unfortunate. And you think of someone who has English as a second language or is not able to read, those barriers just compound, and so that makes it incredibly challenging. So they will do those things to get the needed services sort of here and now, But the other beautiful part about this that I think is so valuable is that we have very strong members of this consortium who care deeply about our community and have said, let's talk about these issues. So let's bring back that data. Let's track those things so that we can talk about those other issues and think about some larger solutions to those types of problems. So the housing or the low wage type of conversations. And one of the pieces that we'll be doing is, as folks come into the center, is doing some data tracking, not patient identifiers, nothing like that. They're just clients that are there, but we want to know, why are you coming to us? What are we doing for you? Who are we connecting you with? And is there a gap? And then recognizing those things and having conversations about that to solve for it.
Yeah, just to echo what Kylie said, it's one of the biggest thing with what we're going to be doing with the center is tracking that data, so we can, so we can go back and actually advocate for change within our community, to our own local government, to our own local leaders as well. But we have to start somewhere, and that's where we're going to start. And we're hopefully over the years, we're able to compile some data and be able to provide some feedback. As we have a very strong, foundation, I know we have the influence to be able to maybe, be loud and advocate for a change.
Great, thank you. Also, several questions about other navigational partners that are out there, other groups, whether it's health and welfare, a number of different attempts that we've had in society to try to navigate people to the resources that are out there. Because I really thinking and speaking from getting to hang out with these two and talk about this, I really think a lot of the concern is not that there aren't resources available, but it's essentially, how do people access those resources? Do they know about them? Are they able to get to them? So I've got a couple of questions in that vein that I want to start with. And maybe we can start with something that you talked about, Maria, and that is the location of the Center for Community Health and how that dovetails with the data that Kylie provided to us at the beginning.
Well, like mentioned, the data was showing that where our census was showing, track 11, is the most need. Our location is going to be an easy point, easy access to somebody living in that area that could walk to the center and ask for assistance. Our goal at that moment when somebody's walking in or needing that assistance is to be able to maybe help them navigate all the services within, near them, or be able to take care of them ourselves so they don't have to go search around and go to 10 different places to get maybe the same information that we can give them. So I know that's a big part of why the reason the consortium went with the center and went with, allowing Twin Falls School District to be able to provide that location is because the need is there, and that's a very hot spot. I think we're going to be able to reach a lot more of those that need it.
And I just want to add that, we aren't intending to take over any of those other services. Yeah. Those are absolutely needed. And if you look at some of the research and data that's out there talking about this type of role, our catchment area for the Magic Valley is around 200,000 residents here. And the recommendation is about 1 per 10,000 to have sort of this community health worker role within a community. And then when you talk rural communities, it's 1 per 5,000. And so we aren't there by far. So we know there is more need than what we have. And so, we look at everyone like a South Central Community Action Partnership, like our navigators with health and welfare, as our partners. We are working collectively together to do this in tandem and help our community. And so, it's not intended to overtake any of them. They are amazing partners doing great work, and we just need more support.
Okay, thank you. Next question is kind of in that same vein, and I know it's something that we have talked about, and that is about getting the word out. And I think every time we talk about getting the word out, Maria panics a little bit because it's like, we're not ready yet. Let's not be getting the word out and sending people down to the Twin Falls School District for services, as I'm sure Twin Falls School District personnel would also prefer that we not do that. We're just not quite there yet. But what is the plan for getting folks to know about this? I mean, it's only a resource for the citizens of the Magic Valley, for the residents of the Twin Falls area, if they know about it. So how are we thinking about marketing, community awareness? what kind of strategies are we already getting in place, and where do you see us heading down the road?
So first, marketing. We're planning on, well, we're actually already been doing kind of that. I'm meeting with multiple different organizations who are already doing this type of work and talking about what we're going to be doing, and talking to them about partnering up with us when we're eventually open. The consortium, I also know, is has a big role in this too, because they're taking it back to their organization, sharing that information, word of mouth, everything like that. So a lot of it that we've been doing and planning to continue doing is just talking about it, making it other community partners aware of it, working through the consortium or through the organizations I personally work with, just letting them know. And I know CSI has been great about marketing and helping us market that as well. So.
And this is our first kind of community showing here, and we're so grateful for that. And I think we have a few more on the docket, some of the service clubs and different things like that. Those are already planned for. And if you are a part of any of those or groups that we can come speak to, we want to do that and just continue to ramp those things up as we get closer and closer to opening the doors. And so it does sort of take all of us. I think the motto by the community for the community is really echoes within that. It is a challenge what you're saying about resources. I have lived that a long time, and I recognize that it's a real issue. We do hope to be a really good, but also sort of specialized in that functionality. And it's the day-to-day job of that staff to know that and do that every single day. And so there's not a lot of folks that get the time to be able to help support our community like that. And so I think that's going to be a big asset for it as well.
Great. Another question, you both talked about mental health crisis in the Magic Valley. And I think you briefly also, Maria, talked about some of the other things besides navigating to mental health services, navigating to food, housing, things like that. What do you envision? Do you envision anything at the Center for guiding people to financial planning, financial help? You mentioned insurance, but specific question about financial planning and those resources that are available.
So essentially, when we're bringing or helping a client come in, we want to be able to, our approach is going to be, assessing where they're at, kind of meet the client where they're at and assess their needs, work with them on their priorities, work on things that we, actually could fix for them or help them fix or help them navigate that. And also talking to them about the reality of things and being able to maybe budget with them and help them, teach them how to budget, teach them how to navigate those services for them, for not to come back or for them to be able to stand on their own feet. Planning some classes as well, eventually holding scale classes in the community and at the center for public to come and learn about how to budget or how to maybe eat healthier or how to help somebody with opioid abuse, things like that, to be able to kind of empower individuals to stand on their feet, to be able to, be resilient and be able to, do it on their own and help somebody else in need as well.
Okay. Simple question. What are the requirements to be able to be served by the Center for Community Health?
0. It's a free service. Anyone who finds themselves needing assistance, whatever that may look like, come in. We'll assess your need, see if we can even help you. If not, we'll help you go to the right place.
Okay. All right. You said the word free. And you also mentioned about the need for assistance. So a couple of different questions asking about funding, about long-term plans for funding. Kylie, you mentioned a couple of times that there is a Center for Community Health. There's something very similar in the Wood River Valley, but kind of that long-term funding mechanism. What is the vision for the Center for Community Health and how we sustain that funding, and maybe even a little more about how we got to where we are today and what we see as funding mechanisms going forward?
I take the first part of that. And I think it took a lot of work to just get to this point. And I will say the first part of that is sort of open dialogue and transparency about who can do what and who's best at it. It's like we're all in this together, and we can own our roles and identify the best partners. And so even landing on Family Health Services as the employer was a really great dialogue around who's really well suited and has the skills and meets the community where they're at in the best way. And ultimately we landed there, the school district, in a great location with their support services. That recognition is that there's people in there doing similar work. How do we partner? And that's just a great tool and strategy there as well. And so, the consortium as a whole, those are the conversations and dialogue that group is having, and is really authentic and transparent to get to that place. And so we have a lot of, pieces that are already in place in sustainability built into that, with funding for Maria, the location, et cetera. And we'll continue to sort of advocate and seek other partners who want to be a part of that, to help us as we continue to scale this operation. So that would be kind of the next part of this. And as we get out and are able to share, that's a big piece. And we're really grateful for all of our partners that are nonprofits in the group who are able to accept donations and supports for it too. And 100% of those will go straight to the center to help it operate as well.
Well said.
Well done. I'm going to turn back. So Maria, you've got experience in this area. This is not your first go around in helping underserved populations and populations that may be struggling. I think an interesting question here, talking about Twin Falls County is becoming more diverse. Diversity is expanding. What do you think about the cultural barriers to services? Some of the cultural obstacles that maybe people have to seeking services and being served in a situation like this, and how has the group thought about trying to address those sorts of issues?
Well, that is true. Twin Falls is a lot more diverse than when I first came to Twin Falls. I remember being the only Hispanic sometimes in my elementary school in '97. So one of the things that we're hopeful to do is to bring in staff that are possibly bilingual, either in Spanish or a different language if the need is there. We're looking at, a lot of the population I have served in the most years have been Spanish speaking, and they are scared to go receive services in other places because they don't know. Nobody is, even though I know the translation is there, or they're trying to assist them through a translation line or a language line, they still are hesitant to go receive the services for whatever the reason might be. They're scared. So the way I look at it, the way I wanna be able to assist in that way is to be transparent, be able to provide, the assistance in their language. That's one of the ways, and that's by bringing in bilingual staff or having the language line available for them to be able to assist as much as we can.
And Maria touched on a lot of the trainings and things that they'll go through, which will help equip them to do that. And a core sort of tenet of community health workers that they are a part of a community.
Yes.
When you hire a community health worker, you're really looking for someone who has lived experience, who can speak your language when you're serving someone. And that's a big principle of what we'll be searching for in that staff as well.
Okay. I've got a question I'm going to ask you both to respond to as we come to a close this evening. I want you both to speak to, and Kylie, you can skip this because I already asked you the first half of this, but I'm going to ask Maria as well. What excites you the most about where we are with the Center for Community Health today, and what's your biggest fear? What's your biggest concern? What's the obstacle that you think we need to get over, and that people in this audience might be able to help you get us over that barrier?
What excites me and what's my fear? Well, I'm excited to be part of this project. I'm excited to be able to put a stamp into something that I know the consortium team has been working for so long. It's a way for me to kind of give back to a community that received my family and I when we first came here. Sorry, my mom is here, so I don't mean to get emotional. We were privileged enough to come to this country. I was very young, and we were privileged enough to actually have the opportunity to come. thankfully, we had different organizations, kind of like this, that helped my parents understand the way things worked here. You know, from us, how to register for school, how to, important it is to get your vaccine, where to go for dental care, get our visions, where to get a job that maybe can help you with insurance. You know, seeing that growing up actually pushed me to kind of work in this type of field, you know, to give back. And I made it a goal for myself to eventually grow up and do the work that we received when we first came here, to help somebody else the same way we received that help. So with that, my biggest fear would be to be overwhelmed and not have enough staff, because we know the need is there. We know that that there's multiple families from all different backgrounds who sometimes just need that one person to help them navigate those services. That person who just takes the time to listen to them. You know, not to call them up and say, hey, yeah, I'll see you in a week. I want them to be able to say, you know, come in. I'm having a moment now. I need your help now. I want the center to be that. I want the center to be a place that somebody, if they have time and they need that services at that moment, that they can feel comfortable and able to go to the center to receive what they need. So with that, I do fear that I won't have enough staff to be able to provide the services. And that's why we're here.
Follow that, Kylie. Go ahead.
Sorry.
I will say
Get
what
emotional.
excites me is to create more Marias in this world.
Yeah.
Right? We need more of her, and I think this center helps create that. And she's the perfect person to do it. Fear, falling flat on my face. That it falls on its face and that we don't have the support, you know, to just keep moving forward. It has been my baby for quite a long time, and I know the value and need is there. And so I want to give it everything I possibly can to make it successful and be full green light, ribbon cutting, red, beautiful ribbon, and operational and rocking and rolling.
All right. Well, thank you both very much. Let's give them a first round of applause right now. Well, I don't know if I can assure you that it's all going to go perfectly, Kylie, but as both of our speakers pointed out, there have been a lot of people that have put a lot of work and time and effort into getting here today, and a number of organizations. You saw them on the slides, from the city, the county, the college, local healthcare providers, Twin Falls School District, Family Health Services, lots of different entities that have been involved to this point. So I think you know that there is support there. There's a significant amount of support, and there certainly is need. Unfortunately, we know that the need is there. The need to connect folks with the services that are available is critical. And I really thank you both for all of the effort that you're putting in, and wish you the best as you move forward. So on behalf of City Club, I certainly want to thank these two. I also want to thank President Fisher and the College of Southern Idaho for hosting, on behalf of City Club, for hosting tonight's event. I also want to thank the Harrod Center staff. This doesn't just happen. Someone's got to come in here, get things set up, keep the lights on, turn the heat down, things like that, to keep it comfortable. And I certainly want to thank you. Lots of great questions that came in tonight. And I didn't get to all of the questions, and I'll be honest, I think there are several questions that I thought to myself, we need to save that. And we need to do another one of these that's looking at different healthcare issues in the Magic Valley, because there were a number of questions that are talking about different issues that seem to be a little bit tangential to exactly what these two have in their expertise, but they're great questions, and they're questions that, you know, as a city, as a county, as a society, as a state, we need to confront. We need to talk about how do we address these challenges. That's exactly what City Club is for, to have that civil dialogue about these complex issues. I know you're used to seeing civil dialogue throughout our society today. That was a joke, yes. So we want to have at least a little pocket of it, because I do think, getting back to some of the questions as well, you know, it is easy to look at something like this and say, yeah, but there's still going to be a lot of problems. But I think, as many people wiser than me have said, you've got to start somewhere. Got to start somewhere. Got to start with the little pocket of the world that you can control, and that's critical. Before you get out of here, though, I do want to let you know about the next City Club event. Speaking of civil dialogue, on April 23rd of 2024 at 7 p.m., you can join us to talk about what is likely to be a very timely topic, election security. So our next City Club event, right in the midst of primary season, we'll be talking about election security. Again, April 23rd, 2024. We do invite you back for that. And without a doubt, we will be discussing healthcare in the Magic Valley and healthcare issues again in the not too distant future. So thank you again for coming tonight. We really appreciate you supporting City Club, and have a great night.
Thank you. Thank you, Chris.